what cooking oils do you use at home? This may seem like a relatively insignificant health-based question, but it's actually rather important because the devil's in the detail. Little things matter. I'd much rather solve a bunch of little problems than trying to overcome one big problem. And these little ones do add up to big positive health results. So what cooking oils do you use at home? I ask at home because at restaurants, generally you don't have control over the cooking oils, and we live in a corn and soybean economy, so I can guarantee you that the oils being used are largely soybean oil and corn oil. That's not necessarily a bad thing, but we're just getting way too much omega-6 oils. And the vegetable oils, the corn oil, and the soybean oil are all omega-6 based. Let's see what the problem with omega-6 based oils is all about. So Dr. Joseph Hibbeln, MD, I have a lot of respect with him. He's at the NIH. In his food and behavioral research program, he says that over-consuming omega-6 fats and under-consuming omega-3 fats, that's the crux, significantly increases inflammation. So omega-3 oils are the soybean oils, the corn oils, the vegetable oils, whereas the omega-3 oils are the fish oils, and many of us aren't getting enough omega-3s. Now, we need omega-6s, but the ratio that's optimal is 3 omega-6s to 1 omega-3. We've been testing people at 20 to 1 and 40 to 1. This is what upregulates inflammation. Too much of a good thing. And it leads to a myriad of disease, heart disease, diabetes, obesity, so on and so forth, rheumatoid arthritis, macular disease, cancer, psychiatric disorders. So I can assure you that these very different diseases is just the tip of the iceberg of inflammation-driven diseases, and consuming omega-6 fats in excess is something that you can certainly manage. Avoid restaurants, cook with olive oil, coconut oil, healthy oils like that, walnut oil, avocado oil. So the devil's in the detail, small things matter. Try to avoid the omega-6s, try to increase your fish oil content, and you'll be down-regulating inflammation and hopefully ameliorating or preventing some of these many of these chronic inflammatory diseases. Thank you very much.